Good afternoon and welcome. We are delighted to have you here today. On behalf of Sam Houston State University School of Nursing faculty and staff, I would like to welcome the students of Cohort 21, the class of May 2023, and their family and friends to our white coat ceremony. My name is Devin Berry. I'm the director here of the School of Nursing, and I want to say one more time that family and friends, we're so glad to have you here. For these students to know that they've got somebody at their back, somebody supporting them, somebody willing to show up is huge. They've got a perilous but possible journey ahead of them. They will do well, but it will be through the help of the people around them that they're able to accomplish this. So we welcome you to this celebration. We ask that you would please silence your cell phones. I would like to welcome Jennifer Idogu, one of our faculty, to the podium.
Welcome. Sam Houston State University admitted the first group of nursing students in January of 2011. We have grown from the humble beginning of 20 students and 5 faculty to where we are today. There are 491 pre-licensure students and 84 RN to BSN students, 22 full-time faculty, and 10 full-time staff. The School of Nursing has graduated 718 pre-licensure students and 51 RN to BSN students. These graduates are helping to improve the healthcare of our community and our nation. This ceremony is very special. As students, you have entered the foundation phase for your career as a professional nurse. Preparing for nursing means changing. Nursing is both an art and a science. Nurses are privileged to be with people when they are the most vulnerable. We provide support both emotionally and physically for patients, family, and the community. Students who commit to the nursing profession must be dedicated, passionate, intelligent, and mature. At this time, I would like to recognize our faculty and staff, without whom this school would not exist. Faculty and staff, please rise. Come on now. During this ceremony, we will present you with a white coat to symbolize your entrance into our profession. Historically, the ceremony symbolized entrance to the profession of nursing as a student nurse. In 2014, the Arnold Gold Foundation and the American Association of College of Nursing funded 100 schools to start the white coat ceremony as a new tradition for nursing. Sam Houston State University was fortunate enough to be selected for that opportunity. Congratulations as you embark on your journey as your career as a professional nurse. Seek to learn all you can from the patients you will encounter in this journey, and may they be blessed by your care. Thank you.
Before I introduce our guest speaker today, I'd like to make a brief disclaimer. I'm departing from our tradition of having a nurse speak for 2 reasons. First is the unprecedented importance of interprofessional practice. For those of you that may not be familiar with this idea, it is the simple but profound idea and acknowledgement that care happens best when it is delivered by a team. In today's healthcare environment, it is often the nurse and the physician that are at the center of that team. Second, at the School of Nursing, we are continually working to recognize one another as whole persons. We're not just students, we're not just faculty, we're not just staff. We're teammates, we're employees, we're citizens, we're church, mosque, and synagogue members. We're spouses, we're siblings, we're parents, we're children, we're friends, and we're grandchildren. Today, we have the special honor of having a grandparent physician deliver comments to the incoming cohort of nursing students at Sam Houston State University. Dr. Vestal Caperton was born in Dallas, Texas, into the baby boomer generation. a generation that may well have seen more change than any generation that has ever preceded it. He completed his BA in 1972 in biology and chemistry at Baylor University and the University of North Texas, graduating summa cum laude. His MD in 1976 at the University of Texas Southwestern Medical School, and his family medicine residency in 1979 at John Peter Smith Hospital in Fort Worth. Shortly after, he moved to Conroe, where he practiced family medicine for 42 years, retiring just this past summer. He is a member of a number of professional and honor organizations, served as the past Chief of Staff of Conroe Medical Center, and currently serves with Baptist Medical and Dental Mission International, having done many years of mission work in Mexico and Honduras. He has been married to his wife, Chada Caperton, who is able to join us today, welcome, for 49 years. The Capertons have 2 sons, Chad and Kevin, and 5 grandchildren from ages 6 to 21. Dr. Caperton enjoys hunting, fishing, and cycling. The oldest of those grandchildren, Melinda Caperton, is a member of the nursing class that will be receiving their white coat today. Please help me welcome Dr. Caperton. Are you okay with that, Barry?
Yeah. I think after that, I need some more initials behind my name. So good afternoon, and Mia, thank you for including me in this memorable event. And so you look great, but you're going to look awesome in white. So there's a little more about me that I want to tell you. I wear 4 hats at least. Did wear 3 today, I wear 4. The first hat is my granddaddy hat. That's what I call the poppy hat. So I wear that. I'll always wear that. The second hat I wear is a doctor hat. I'll always wear that. Even though I've retired, I will always wear my doctor hat. It's hard to give that up when it took so hard, took so much work to get it. The third hat I wear is a teacher hat. You wear the same hat as well. Every patient you encounter, you're going to teach. Whether you know it or not, you're going to teach. And I did that for 42 years and still do. Even though I'm retired, I still teach. The fourth hat I wear is a speaker hat. And that hat doesn't fit. That is a big hat, okay? It comes down over my ears. So, not something I pursue, but yet I do, and this is a great privilege for me to be involved in your white coat ceremony. I do know one thing, or actually a couple of things about speaking. If somebody asks you what you're going to speak about, say, well, I'm going to speak about 10 minutes. True. Also, speakers, if you're going to speak, what I've learned is you got to have 3 points. And so I have 3 points. So I'll say those 3 points up front. First of all, first point, God made people, and God loves people. So it's about people. Second point, love people. You wouldn't be in nursing if you didn't love people. But this is an imperative. Love people. The third point is, I want you to get this point today, if anything, is you do nursing with your hands. You do nursing with your head. You become a great nurse with your heart. From your heart. Not just with your heart, from your heart. So how can you be a great nurse? Again, it's not in the being, it's not in the doing, it's in the being. So in med school, as well as your schooling, I'm sure you've used acrostics, or you've used acronyms, or you've used mnemonics to memorize and remember things. We did that when we tried to memorize all the cranial nerves. So today's acrostic is nursing. Nursing. So let's go with the N. Be nice. Be kind. Be warm-hearted. Be considerate. Be humane. Be sympathetic. Be tender. Be gentle. That's the N. Be nice. The U, be understanding. Look and listen and observe. See them. Many of your patients will be frightened, they'll be worried, confused, angry, frustrated, hopeless, possibly dying. They're in danger. Remember, it's about them. Understand them. That's the U. The R, respectful. Be respectful, which means feeling or showing deference. Show consideration. Show regard for them. Show admiration. See the good in everyone. That's the R. S, be sensitive. Be quick to detect slight changes, signals, having a quick and delicate appreciation of their feelings, caring, being aware of needs. If you see them more than once, you're going to be able to tell the difference sometimes when something's wrong. That's the S. The I, be interested. Be curious about them. Engaged with them. Learn their story. They all have a story. When we were using paper charts, which we did for 40 years, just a couple of years ago we converted to electronic, I would always write something down in the chart about that, on their history sheet, about that patient. Maybe they were a hunter, or they cycled, or they fished, or something unique about them that I could always remember. And they were amazed that sometimes I remembered those things. Of course, I was cheating because I looked at the chart. But it shows your heart. They all have a story. The N, be nurturing, which means to edify, to build up, to take care of, to protect, to encourage, to foster, to nourish, never to harm. You know, when we were in med school, supposedly we were, I guess, supposed to take the Hippocratic Oath. I don't know if I ever said it or not. But in that Hippocratic Oath, there is a part in there that says, never do harm. At first, do no harm. And then the G, be gracious. Showing grace, showing courtesy, showing goodwill, honor them, show unmerited favor, unexpected generosity. So in review, be nice, be understanding, be respectful, be sensitive, be interested, be nurturing, and be gracious. So I end with two quotes. St. Paul, the apostle, said this in his letter to the Colossians. He said, in whatever you do, whether in word or deed, do your work heartily, with a big heart. That's what that means, big heart. And second, wise King Solomon said this in one of his Proverbs. He said, whoever refreshes others will be refreshed. So of all the things that I'll miss about practicing medicine, it's not electronic medical records. It's not meeting quality measures. It's not filling prescriptions. It's not being on call. It's not delivering babies. It's not doing surgery or assisting surgery. What I'm going to miss the most? People, patience. So, challenge to you, serve with a big heart. It's an honorable work you do. We need more of you. You are our boots on the ground. Thank you.
As they get ready to come up, I'm Dr. Kelly Zinn, and I had the joy and pleasure of teaching every one of these students last semester in their very first semester on our program. So I'm happy to see you up here today. Dr. Johnson Makaya is the Assistant Director for Didactic Learning, and she will be doing the coding today. Catherine Adams. Olobumi Adesui. Rachel Alfredson. Donna Jane Arceo. Nena Arise. Kieran Bongash. Maria Benitez. Adeline Branson. Shantavia Brown. Madeline Breyer. Ashley Bird. Taylor Caldwell. Mia Caperton. Oh, geez. Guadalupe Cerda. Isba Chowdhury. Cecilia Conde. Anish Correa Alverio. Amanda Crowder. Jared Cruz. Rose Daniel. Kylan Dillard. Adesola Fashola. McKinley Fennell. Rachel Fuller. Juan Garcia. Amber Guerin. Herbert Guevara. Suji Hod. Pamela Henderson. Emmanuel Herrera. Caitlin Huffman. Sophie In. Brianna Jane. Christopher Johnson. Alicia Jolivet. Destiny Jones. Rebecca Losh. Lee Lin. Shauna McCraney. Wait. Paulina Medina. Maria Mendino. Maggie Montgomery. Abigail Neblett. Lynn Nguyen. Brittany Norman. Nicole Othout. Nicole Okoronkwo. Daisy Olmos. Sarah E. Ortez. Corey Owens. Jamilat Perdomo. Emma Price. Jesse Quaser. Arnella Rakovac. Marissa Reyes. Tanner Rhodes. Jacob Rios. Isabella Rodriguez. Damian Rojo. Ruby Rojo. Casey Safford. Jose Sanchez. Melissa Sanchez. Alyssa Santoy. Zoe Schmidt. Jenna Smith. Sherelle Smith. Andrea Torres Nieves. Andrea Villaneda. Nen Vo. Carlin Wager. Kelsey Watson. Rakisha Watson. Madeline Williams. Alexis Wilson. Karis Wyatt. We'll pause just a minute to let Karis do her signing, and then we will be doing the oath, which is in your program. I'll stand. If there's any nurses in the audience, I invite you to say the oath with us. As a nurse, just keep going. As a nurse dedicated to services, I solemnly pledge that I will consider the welfare of humanity and relief of suffering using cultural sensitivity in a global environment. Act in a compassionate and trustworthy manner in all aspects. Apply my knowledge, experience, and skills to the best of my ability to assure optimal outcomes for my patients. Exercise sound judgment, abiding by legal and ethical requirements. Commit to preparing for and attending all educational experiences. Accept the lifelong obligation to improve my professional knowledge and competence. Promote, advocate for, and strive to protect the health, safety, and rights of the patient. With this pledge, I accept the duties and responsibilities that embody the nursing profession. I take this oath voluntarily with the full realization of the responsibility which I am entrusted by the public. Turn around and face your families. That concludes our ceremony. Thank you all, family and friends, for attending, and nursing students, stay put so our photographer can give you directions.